Hello friends, today we are going to talk about ACL injuries of the knee joint. So what is ACL? ACL is anterior cruciate ligament and it, it is one of the important structures of your knee joint which connects the upper bone, that is femur, to the lower bone, that is tibia. The other important ligaments inside your knee joint are the PCL, the collateral ligaments, which includes lateral collateral ligament and the medial collateral ligament. But the most commonly injured structure while playing or any pivoting injury to your knee is the anterior cruciate ligament. So what happens when such kind of injury occurs? So this not only limited to the sports person, this can happen to anyone. Most commonly I see female patients who are having a slip or having a twist of knee while going downstairs or while riding a scooter, etc. So anything which causes twisting of your knee joint, it increases load on your ACL ligament. So once your ACL ligament is so much so loaded that it gives its way and there is a pop sound, classical pop sound that happens, and that usually corroborates with ACL injury. So how the patient presents? So the patient classically comes to me with a massively swollen knee, lot of pain, and patient usually is not able to walk. So when they come, so the first investigations that we do as an orthopedic surgeon is that an X-ray. In most of the instances, the X-ray turns out to be normal, and we tell the patient that it is a soft tissue injury because the bones are not injured. So whenever your X-ray is normal, the bones are not injured, and we label it as a soft tissue injury because on X-ray, the soft tissues, which includes your ligaments, your tendons, your muscles, they are not visible on an X-ray. So what happens is initially we have to lower down the swelling with the help of ice packing, doing splintage with the help of a knee immobilizer, and taking some medications. So all these things, they help out in reduction of swelling. And meanwhile we examine the patient. So in such ACL injuries, these patients technically have an anterior drawer test positive, which usually we do after the swelling subsides and the pain subsides. So initially, during my first clinic visit of the patient, I don't do anterior drawer test. So I do a latchman test. What is a latchman test? So in this case, we just have to flex the knee joint to 30 degrees and check for the anterior movement of your lower bone, that is tibia, against the upper bone, that is femur. If this anterior translation is there, so that is one of a positive sign that there is a possibility that your ACL is injured. So that can be partially injured or completely injured, so that depends what kind of injury you had. Other associated injuries with the ACL tear are usually lateral meniscus tear. So the classical pivot injury leads to loading of ACL and along with the lateral compartment of your knee joint, so which causes a tear in your lateral meniscus. So now what is meniscus? So these two structures, as you see over here, these moon shaped structures, these semicircular structures, so these are the pads inside your knee joint. So they are the shock absorbers inside your knee joint. They help in absorbing the shock while you walk, while you in day-to-day activities. So what happens during ACL injury, the lateral meniscus also gives way and there is massive loading on your lateral meniscus. So this leads to lateral meniscus tear as well. But yeah, there can be other variations. There can be a medial meniscus tear. There can be associated PCL tear, that is posterior cruciate ligament tear. There can be an MCL tear. So such conditions are called as multi-ligamentous injuries, and they are tackled in a different manner, and we will talk about that in subsequent videos. So as I've already told you, during the initial my clinic visit, patient usually has such complaints of swelling, which happened immediately after injury. And in case of isolated meniscus injury, the swelling happens after an interval, maybe the next day. So what is the ideal treatment? So initially you just have to take some rest. We don't have to go and directly operate on your ACL ligaments because the earlier we operate, there are chances of not so good results as per the research studies that are available right now. So it is always better to take a pause of maybe 2 weeks to 3 weeks, let your knee become silent, and then go ahead with the ACL reconstruction. So what I usually do is I take a gap of 2 weeks, and during this 2 weeks time, maybe by the end of 1 week, when the swelling decreases, I get an MRI scan done, and that clears up the picture that whether the ACL tear is complete or it is partial injury. So both of the things are different. If it is a partial injury, usually it gets heals on its own or with the help of some conservative treatments like PRP injections inside your knee joint, along with some rest with the help of knee immobilizer or functional knee brace. But if it is a near total ACL tear or if it is a complete ACL tear, then we should not wait for a while, because in young patients where this injury usually happens, uh, this leads to internal derangement of your knee joint. So what happens is the normal mechanics, biomechanics of your knee joints gets deranged, and in such condition, this knee tends to have uh, more wear and tear as compared to what it usually has naturally. So when this more wear and tear happens, this leads to an early onset arthritis of your knee joint, and in such cases, you would land up in a bad knee, bad arthritic knee over the period of maybe few years or few months. So what should be done? So in case of young patients, I'm repeating, ACL is not to be reconstructed or repaired in older patients who already have arthritic changes inside the knee joint. But older patients who have good pristine knee joints, non-arthritic knee joints, they should have, if at all they got this injury, they should have an ACL reconstruction done if at all they have got this injury. So what my plan of action usually is that when an ACL injury occurs, we prove it with the help of an MRI, and usually MRI is very important to go for insurance claims, and that is also good for patient to understand ki, yes, I do have an ACL tear and I need to get this operated as early as possible, because otherwise the patient who's having ACL tear or neglected ACL tear, they tend to have this common pivoting of the knee, common instability of the knee, specifically while coming downstairs, while going on trekking, etc. So that is very difficult to live with. So what I plan out is, right now I am doing an all inside ACL reconstruction of knee. So what is an all inside ACL reconstruction of knee? Earlier on, it was outside in or inside out. There were different techniques. Right now we are doing an all inside ACL technique, in which we put your graft inside the knee joint and create a tunnel on the upper side, on the lateral upper side of the femur, and on the medial side of the tibia. Okay. And we don't earlier on we used to use a big screw inside your tibia and a small plate on the femur. So now that small plate, or endo button that we call it, is still being used, and it is really very small. At the same time, we use a very small button over here, so that this decreases the amount of bone that is being drilled. Second, it gives more stability to your new graft, which is being used as a new ACL. And along with that, I do prefer an internal bracing technique. So what is an internal bracing technique? So internal bracing technique helps us in mobilizing you early as possible. So when we do a conventional ACL reconstruction, in case of conventional ACL reconstruction, what we do is the rehabilitation takes about 6 months for you to go back to your sports, most commonly football. But in case of internal bracing, what happens is you may go back to your sports after just 3 months. So it decreases your rehabilitation time to by 50%. I would say it takes just half of the time for you to get back to your sports. Although with internal bracing, there is an advantage that you can get your knee bent 90 degree by next day of the surgery. So it adds a lot of benefits, internal bracing, as far as our day-to-day activities are concerned. Because in this post-COVID era, what is being happened is that most of the young people who got this injury, they are working for some MNC or any private firm. The problem with those is that you don't get to have a lot of leaves from the firm. But in this all inside technique, along with internal bracing, what we do is we allow you to go back to your work after 15 days, just 15 days. And if you play football or basketball or volleyball, whatever do you play, you can get back to your sports, you can get back to the gym in just 3 months. But please note, it is not that you will be normal in 3 months. No, it is not like that. You will be doing all the activities that you do, all the household activities, everything, just after 1 week to 10 days after getting this ACL reconstruction done with the help of all inside technique and internal bracing. So yeah, again, ACL is not a big deal. Yes, if it happens, if this injury happens, it becomes a big deal for the patient. But trust me on that, my patients are very happy with this all inside technique along with the internal bracing. Please note that I am not criticizing the conventional technique. We have been doing this conventional technique for years now, and the success rate is comparable in both the things. The only difference with internal bracing and all inside technique is that rehabilitation is a bit faster. So if you have maybe you have your league lined up maybe 6 months down the line, and you have to get back to practice within 3 months. So yeah, internal bracing with all inside technique is for you. That doesn't mean you cannot go for the conventional technique. Second, the most common question that I get from the patients who do not play sports, who are just normal, who just have normal sedentary lifestyle as me. So those patients are much more worried after watching a lot of YouTube videos like mine. So yes, I want to clear the air here that there is, for you who are not playing any sports, there is no difference in internal bracing versus conventional technique, because you don't have to get back to sports in 3 months. So in both the techniques, in conventional as well as that in internal bracing, in both the techniques you will be get back to your work within 15 days to 1 month. So I don't think you don't have to rush. So please do not get confused. I get a lot of patient queries that I am confused. I've seen people myself who have been watching videos, 10 to 11 videos per day, and meeting all of us who are making contents on YouTube, all the leading arthroscopy surgeons. So the problem is that the results don't differ as far as the research says. There is no difference in any research in results in internal brace versus conventional ACL reconstruction. So trust me on that, both are good. But if you are a sports person, internal bracing with all inside technique is a thing for you, is a thumbs up for you. And as far as the rehabilitation is concerned, I would say you have to have at least 1 to 1.5 months of dedicated physiotherapy and rehabilitation from the consultant, or under the supervision of the consultant from where you have got yourself operated. So as far as our patients are concerned, every person is super happy with all inside and internal bracing. So right now we have made a protocol to do. There is nothing harm in doing more than not doing a latest technique which is available in the market right now. The downside of internal bracing and all inside technique is that the cost of surgery increases, because the type of implant is different in internal bracing along with all inside. So in all inside technique we use a special instrument called as flip cutter. So that costs a lot. That is a disposable thing that cannot be used in different patients. So that is once opened and can be used only in a single patient. So that costs, so that adds to the cost of surgery. Along with that, the internal brace itself costs a lot, and it adds to the total surgery amount. So if you have got, if you do not play sport, if you have got a budget issue, you do not have any insurance, then I would suggest go for a conventional ACL reconstruction. There is no harm. But if you are a sports person and you have to be really competitive and go get back to the competitive sports, within few months, then I would recommend go for internal bracing with all inside technique of ACL reconstruction. Do not get confused. So I have made this video specifically for those patients who are confused between getting this or that. Thank you.